Hi, I'm Dr. Kelly Wallace from Catawba Heights Animal Hospital here to talk to you about cats and lab work that we recommend. What is lab work for cats? Lab work for cats is annual to semi-annual blood work that we either run here in the hospital, but most likely send to the lab, where we're looking at the red blood cells, the white blood cells, um, platelets. We're also looking at the size, shape of your red blood cells, looking at liver, kidneys. We also can look at the heart. We look at urine, and then we also look at a stool sample to check for parasites. Why is lab work important for my cat's health? Lab work is very important because cats are great at hiding disease, and by the time a cat shows outward signs of disease, things are very advanced. The earlier we can catch things, the more likely we can treat them with medications, and your pet can live a longer, happier life. What are the most common lab tests performed on cats? Well, we have our CBC, which is a complete blood count, looking at your red blood cells, white blood cells, platelets. And then we have a biochemistry profile or blood chemistry profile that's looking at your internal organ functions like liver, kidney, also looks at electrolytes, proteins. And then we test their stool sample looking for parasites, and the urinalysis looking for infections, looking for crystals, and also looking at, it also gives us a picture about the kidneys. How often should my cat have lab work done? At minimum once a year. As pets get older, they age more rapidly, and we recommend twice a year, but at minimum once a year. How long does blood work take? For us, it takes around 2 to 4 days to get back from the laboratory. We run a cardio pro BNP on all of our blood panels, which tests for stretch of the heart, which is essential in cats because they're known for hypertrophic cardiomyopathy, which would be very difficult to diagnose. That test alone takes 48 hours to get back. Typically, we have everything back in 3 to 4 days. Is lab work done painful and stressful for a cat? I wouldn't say it's painful. And usually, it's more painful for the owner than for the pet. It's a stick with a needle. We try and make it as most comfortable for the pets as possible. It can be stressful for a pet just simply because they don't understand what we're doing and why we're doing it. We try to make it as less stressful for the owner and for the pet as much as we can. There are some cats that simply won't tolerate it. So we might suggest that you give a medication before your cat comes in called gabapentin to help alleviate that stress. And there are simply some cats who just will not tolerate it, and that's when sedation comes into play. While sedation does sound scary, sedation is safest for the pet and for us. The pets can't hurt themselves, can't bite us, can't run away, can't get hurt, but also they don't remember things. So it's much safer and calmer for them. How much does blood work for a cat costs? It costs anywhere from $100 to just under $300. It just depends on the age of your pet. As pets get older, they're more prone to certain diseases, so we test more for those. So senior cats or cats over 7 to 8 years of age, we recommend a large or a senior profile that gets your cardio pro BNP. It's going to get more enzymes, more kidney, liver function, but also it tests for thyroid. Cats are prone to hyperthyroidism or overactive thyroid. And that test should be run once a year on pets over 7 years of age in cats because untreated, undiagnosed hyperthyroidism can mask kidney disease, but also lead to heart issues, blood pressure issues. It can cause blindness in cats. It's easily treated with medication. So while blood work as they get older gets more expensive, we are testing for more things because we typically see more things as pet gets older. And if we can diagnose them early, we can treat them easier. And your pet can live a longer, happier life. Can blood work help diagnose kidney disease in cats? Yes, it can. We test for BUN and creatinine, look at kidneys, but we also do something called an SDMA on all of our blood panels, which helps look at the filtration rate of the kidneys. Typically, you can't see kidney failure until you've lost 2/3 of both kidneys, so 66%. So SDMA kind of helps us. Sometimes we might see that the pet is in the high normal range, but not abnormal. That could indicate that the pet is heading towards chronic kidney disease or chronic renal failure, but we can see it. Also, outward signs would be drinking a lot, peeing a lot, weight loss, decreased appetite. What does a urinalysis reveal about my cat's health? Urinalysis can reveal crystals, which are common in cats for urinary health. Especially male cats are prone to blockage, and if we see crystals, then we need to discuss um, diets that we can put the pet on to decrease the crystals, so we don't have a higher incidence of blockage. It can also reveal the kidneys. It looks at specific gravity, proteins in the urine, glucose as well. If you see glucose, your pet potentially could be diabetic. You can look at many things. A fecal exam is performed when we send off a stool sample to the lab. Because our stool samples now test for so many things, we don't collect the sample here anymore with a fecal loop. We typically ask that you bring one in with you, or we'll send you home with a fecal collection cup, and you can bring it back within 30 days of your visit for it to be included with your blood work panel. How should I prepare my cat for blood work? If your cat has been given medication to be given before they come into the veterinarian, like gabapentin, please give that medication. It is common for people to think, oh, my pet will be okay, doesn't need the medication. As soon as they get here, they hear the dogs barking, they see us, they're being, restrained in different positions, having their temperature taken, getting vaccines, they're going to need that medication. So preparing your pet by giving them the medication, if we have sent it home previously, is a good thing. Blood samples are collected from cats. Typically, they're collected from a vein. Typically, we try and use a back leg on the cat because it's away from the head and the mouth. But it's also less stressful for the pet to have it done in the back leg as opposed to up near their face or on their front arm. Is there any side effects or risks associated with lab work for cats? There is the discomfort of the needle poke and having to restrain them. They can bruise at the site where we have taken the blood, much like us. I know I've bruised several times when I've had blood drawn. Those are the highest risks that we have is bleeding, but that usually resolves itself within minutes. And the bruise can last up to 7 to 10 days. How long does it take to get the results from a cat's blood work? Usually 2 to 4 days. The cardio ProBNB takes a minimum of 48 hours, so we're looking at usually 3 to 4 days on average for blood work. Can the cat detect diabetes in cats? Yes. If we see that we have high blood sugar and sugar in our urine over 250 to 300, then we suspect diabetes in the cat, and we'll have that conversation with the owner. What is a thyroid panel, and why might my cat need one? I spoke about that already. A thyroid panel checks for overactive thyroid in cats. It's most commonly seen in middle-aged to older cats. It can lead to further health issues and also mask other health conditions. So we recommend it on all pets over 7 years of age. How are lab results used to monitor my cat's ongoing health? We look at them once a year. You look at liver, kidneys, white blood cells, red blood cells. We can see trends. We might be able to catch that, hey, your cat's kidney values have been slowly increasing year over year, even though they're not above normal. We suspect there's a kidney issue, and we might jump on that sooner rather than, if we didn't have blood work, waiting till your pet was really sick and then seeing them really abnormal. What is feline leukemia test, and why is it important? There are 2 viruses that are transmitted between cats. One is called feline leukemia virus, and one is called feline immunodeficiency virus or feline AIDS. Knowing if your pet is positive for either one of those helps with their long-term care. One, we know they're contagious to other cats through saliva, but 2, those cats might have longer-term health issues like dental disease, and leukemia cats are more prone to certain cancers like GI lymphoma. And cats that have leukemia or AIDS, typically, if they get sick, are sick for a longer time or might need more help getting over something that a healthy cat or cat without the virus might get over quicker. How do I interpret my cat's results, and what questions should I ask my vets? If you have our app, you can see some of your pet's results there. You can, ask for a copy of your blood work results. We'd be more than happy to give them to you. Just ask your vet, any questions that you might have. How are the liver? How are the kidneys? How's the thyroid? How's the cat's heart? Red blood cells, white blood cells. What's the fecal look like? And even if the fecal is negative, we do recommend deworming your pet at least twice a year, just to make sure they're staying healthy. If you have any questions regarding your cat's blood work, please give us a call at 704-827-0616.